let's look at a really quick agent workflow within our chatbot solution. On your screen, you see a chatbot that has been delivering messages and requiring some input from a patient. The patient is going to select, should I be tested, and continue on through this conversation. As an agent, what you see is this conversation happening in real time. You can see that the bot has asked the patient various questions and has now gotten to the point where it's asking about potential exposure to COVID-19. As a patient, I'm going to respond to this and say that yes, I've had exposure. And as I look at the symptoms, I'm going to also indicate that maybe I have or have not had those symptoms. In this case, I'll say I have not had those symptoms. The bot is inferring that I have potentially been exposed but are not experiencing symptoms, and saying that I don't need testing at this time. However, if I develop symptoms, I should call my physician. At this point, I could close the window, but let's assume that the agent actually wanted to interact with this patient. Even though this conversation has not escalated and is not assigned to you, you can go into the Select Agent window and choose yourself in the Assign To section and hit Save. Now that the conversation is assigned to you, you can begin interacting with that patient in real time. The patient will see the message from the agent come across, as well as the avatar image of that particular agent, and can begin responding and having live interaction with the agent. Let's assume that this conversation goes on. You seek some clarification about their symptoms or any other input that they may have made, and you decide that it warrants a video conference. At that point, to request a video conference with this patient, simply click on the video camera icon and select yes, that you would like to start a video chat. Once the patient, who is also prompted with that same request, and indicates that they too want to do a video chat, then you'll notice it come alive on the right-hand side of your screen. And when you're done, simply click the X to leave the conference. Whether you do a video conference or not, all conversations should be closed. Select your status option, change it to closed, and hit Save. That's an important aspect of the workflow because it takes the conversation out of the active All Conversations window, which should contain all patients that are interacting with a chatbot or who have interacted with a chatbot and need some sort of follow-up or agent interaction. And it moves it to the closed conversations, which is essentially like moving them off of your list. So you know that that interaction, that follow-up, that patient need has been met. If a conversation is assigned to you, perhaps you're a physician agent and a nurse agent has gone ahead and triaged the patient a little bit and then assigns the conversation to you and hits Save, those conversations will show up in your Assigned to Me bucket. It is recommended that all agents practice this workflow together to get your flow down before interacting with live patients. Remember, a couple key benefits of agent interaction is that you can begin texting in real time with your patient in a secure chatbot conversation. You can send documents, attach images, even use things like emojis. You can also escalate video conferences and close those conversations as needed. Now let's assume that you need to reach out to a patient who is not interacting with a chatbot. And perhaps you don't even need them to interact with the chatbot, but you do want to reach out to them for a secure communication or a video conference. You can do that on the fly by hitting your blue plus sign. Here you'll search for your patient's name. Most likely they won't be located because you haven't interacted with them before. But assuming that they were, they'd show up on your list and you could select them. Lucy has not had an interaction before, so I'm going to create this patient. I'm going to put a phone number in, a mobile number, and hit Create Patient. At this point, I can customize the text message and hit Start Conversation. On the patient side, on their phone, they're going to receive a text with a secure URL. I just received that text on my phone, and I'm clicking on the link now. I've been brought into the conversation window, and I can begin saying something to my agent, my nurse, my care provider. I'm just going to say hello here. As the care provider, I can now begin interacting with that patient securely in the chat conference. If I need to escalate to a virtual conference, I can do that as well by simply clicking on the camera icon. When I'm done, I will change my status from open to closed and hit save. When a conversation has been closed, the patient can no longer interact with it. That's important because you don't want the patient to have access to continue an interaction that you're not monitoring. Again, when you complete interaction with your patients, make sure you change your status from open to closed and hit save. I hope that this has been a helpful overview of the agent workflow. Thank you.